Evening, Musa. How are you doing?
I'm all right, Jonathan. How are you?
Yeah, I'm all right. I've had an okay day. I didn't get to go swimming, but it was a good day.
Okay,
But not as good
sure.
as if I'd gone swimming. So look,
Okay,
here we
yeah.
are on a podcast. Tell me
hmm
why you're doing this. Why do you want to do a podcast?
I have great conversations with you, Jonathan. I've had these conversations with you over the last 9, 10 years since we met. We were both doing PhDs together, completely different universities on the same topic. It was on cannabis, wasn't it? You know, completely different approaches that we were taking, and then we've met all over the country at some conference or somewhere or another, some esoteric coffee shop or something like this. We've had excellent conversations, and we've never really been able to pin down any of those conversations, isn't it? There's no agenda or minutes or outcomes that we get out of those conversations. But somehow, whenever I leave you feeling a bit refreshed, thinking I've talked about something important, perhaps understood something a bit more. Maybe it's changed my frame of thinking about things a little bit. And you know, I thought maybe we should try this. Maybe we should see how the world takes it.
I mean,
What
I
about you?
agree.
Yeah.
I feel when I talk to you, I come out thinking a bit different, and I find myself telling people throughout the week, "Oh, I had this conversation," and with this consultant psychiatrist, but we were looking at this aspect, and I find myself being taken down realms of seeing things which I hadn't noticed before or hadn't considered. But I do get frustrated that we don't. There's no big takeaway. I never think, right, that's it. I'm going to go and do this. I'm going to change my life because of this, or I'm going to have a strong opinion on this. If anything, my opinions loosen. I don't become more dogmatic. I become less dogmatic.
I, you know what? The takeaway I have overall from all of our conversations, podcast or otherwise, is that we need to talk about these things. We need to discuss them. We need to explore all the angles. We need to sometimes just articulate what we're feeling, where that's coming from, right? And
Mm-hmm.
so, and so when did we meet? 2016, 17,
Yeah, let's think. I can remember it. It's 2015, probably.
15?
16, let's say 16. 16,
So, so
give or
you
take.
are an anthropologist by background, right? Yeah, you're an
By train.
anthropologist. Yeah, by training. I am a psychiatrist. At that point, I was doing a PhD in neurobiological basis of psychosis, right? Um, I was in Kings, you were in Brighton. You trekked up to see me. I can't remember. Maybe you dropped us an email or something like that, right? Um, and we started having a conversation about what cannabis means. We were thinking about it in two completely different ways, right? I was thinking about the biological effects. You were thinking about what this drug means in wider society. Um, and I don't know. I think something clicked there, isn't it? That we had this kind of great friendship from then.
Yeah, my half-hour interview went on for 2 hours.
Did
We
it?
talked and talked. Yeah, yeah. I've still got the tapes.
Oh, you got the
Yeah,
tapes.
yeah. We talked for ages, ages and ages, and I was going because I'd been looking at, if you like, the cannabis people, the industry, the people who used it. This wasn't my PhD. This was postdoctoral,
Yeah,
trying
yeah.
to get away from the PhD. But I became fascinated by the people who were researching the harms, who I never got to talk to, but I heard so much about. And you were at King's, which was famous for researching the
Mm.
harms, and you put out some funky survey. And I didn't even think you would say yes to it. And of course, you didn't just say yes. You then had a really exploratory discussion. I was thinking I was just going to ask you a few questions. You were going to give me quick answers and kick me out the door. But you really got into the discussion, and you were coming from a scientific background, but you were seeing methodologically, you were seeing all these social issues that affected methodology, and you just kept opening it up and discussing it and opening it up. And yeah, I think you invited me back to talk to someone else. I don't think you were happy with that discussion, but it was fascinating. And
All
I
right.
think that's who you are. I think that's who you are. I think you like learning, and I think you like finding more depth in a subject than perhaps those around you.
All right. Let me tell you something, Jonathan. I don't know if I actually mentioned it in that interview or not, but this is something that stuck with me, right? So I go to this big institute of learning, biological psychiatry, all this. And one of my issues, and as a psychiatrist, that's what I do. I talk to people, right? Yeah. And one of my issues is, well, especially for people with psychosis, where we know that smoking weed is bad. I mean, it's not particularly hidden. Do you know what I mean? It has bad outcomes. If you've got very bad psychosis and you smoke weed, you might end up detained in hospital. You might be put on all kinds of medications, all of these kinds of things. What? Why are people continuing to take this when it just keeps having bad outcomes, right? And I remember trying to explore this with some of the senior researchers, very breeders and professors and big people in the department and whatnot. One of them turns around and says to me, I kid you not, he says, well, how are you going to ask that? How are you going to collect that data? I said, well, you ask people, right? And he turns around and says, look, the thing is, if I want to know about how much cannabis they have in their system, I can test their hair. If I want to know how much is in the bloodstream, I can draw it up in the plasma. Literally, if I want to understand about a particular psychological construct, I can ask a validated questionnaire. Why do I need to talk to people? And at that point, my jaw hit the floor. I was like, oh, where is it that I've come? Because, those principles are miles away from, classical training in psychiatry. And I was like, well, what exactly are we doing here? And why are we refusing and failing to understand deeper meaning, right, about cannabis? And so, for example, I think one of the things that we talked about, I don't want to do a cannabis podcast because we've had loads of discussions about this. We'll do this later. This is more about methodology. One of the things I realized while I was there was, there were cannabis connoisseurs, right? So I went to Amazon, I bought all these books. I've got a shelf full, at least half a shelf full of, how to grow the best weed, right? And there were you remember there was a website called Leafly? You could choose different, and it was kind of pseudoscientific in its kind of notation and the effect that you would get. You couldn't possibly know what effects you would get from different type of strains. You'd have to do that in a lab. You'd have to do it over thousands of people. But it gave the appearance of science, and we had this kind of discussion about, what is science, what is not, where is this getting blurred? And so that gave me a really good framework to think about things from outside, I don't know, the conventional scientific paradigm. And I've always valued that, right? I think later I did a paper on this, right? On what what our users telling us about cannabis, and how can we as researchers learn from that? It didn't get published in a big journal, it wasn't any, JAMA Psychiatry or anything like that. But it's one of the more important pieces of work that I did.
But what you're coming back to is what
Yeah.
frustrated you was in this research on people and in the research on people's relationships with, if you like, a plant with cannabis or a plant that's been bred by people into a different
Yeah.
plant. But you wanted to understand the human connection. You wanted to understand it, a science which connected to the human experience, to the subjective experience, rather than just testing them as if you were taking atoms out of a compound. Is that right or not?
Yeah. So it's a question that we keep coming to, I think. And this is why I enjoy my discussions with you, because I'm constantly searching for meaning, right? In terms of, well, yeah, that's okay, but what does that actually mean? Why do, and meaning can be explored, as I get from you all the time, on several different levels, for example, and I'm still not clear on which level I understand meaning. It's something I have with my patients all the time. I'll give you a very simple clinical example of this. I might see somebody with extremely bad depression or anxiety symptoms, and I might find that they have a history of childhood trauma. It's very common. I must see this presentation a few times a day, right? When does that actually become meaningful for me? Do you know? Is it just I find anxiety and depression, and then I find a binary variable called trauma, and they both correlate, and therefore that becomes meaningful? Oh, clearly that doesn't happen. On a statistical level, that does happen in scientific academic papers, right? But in the consultation, there comes a point when you ask about the traumatic history, you ask about how it developed, you ask about the current symptomatology. It kind of all fits into place. This happens again and again in my clinical practice, and I'm fascinated by how I get there and what that means. I still haven't got it. Does that make sense? And having that discussion with you, Jonathan, I think it clarifies a lot of meanings for me, although I don't get answers. Does that
And
make sense?
well, you see, because I mean, for me, I'm
Yeah.
not sure what meaning is. And I use
Okay.
the word, I overuse the word. What does this mean? And I'm constantly talking about meaning, but you know what? If someone asked me to define what's meaning and what is a meaningful experience, or what is a meaningful understanding, and what are people doing when they make meaning, which is a phrase I also use, I couldn't really answer you. And I think, in a sense, that's a nice answer to it because I can't make meaning out of making meaning. So I think there is that thing that we want some clear answer. But I appreciate those thinkers who never quite got there. I find those who've got there, if you read through the literature, those who come out with a position, at some point it's led to trouble. Those who sort of open up and go, well, how can we understand this more, but without holding to our absolute form? Yeah, they resonate with me. I, that's what they do. So I suppose I find myself in that tradition, not of being a great thinker, but of being quite happy without clear answers, even when things are absolutely intolerable.
Hmm. So let's apply this, because it's getting a bit abstract, to kind of the real
Yeah,
life
yeah,
discussions we're
yeah,
going to have in this podcast, right?
yeah.
So we're going to have discussions about wars, about the current state of world peace. Of course, we're
Hmm.
going to talk about Israel and Palestine.
Hmm.
We're going to talk perhaps about Russia, Ukraine. We're going to talk about mental disorder, mental health, the nature of what a diagnosis is. We're going to talk about power dynamics in various situations. We'll probably talk about your Jewish background. We'll probably talk about my Muslim background. We'll probably talk about what it means to be British, something about ethnicity, integration, all of these kind of things. But the thing is, Jonathan, and we'll probably have strong views either way, we're not going to have clear answers. I know this is the one thing that I know.
Yeah, and the funny thing is, I suspect we're also, because we do have these discussions now and again, we're going to talk about ourselves. We're going to talk about our own histories and our own
Mm,
experiences and those of people close to us. But once again, well, I suspect we will have lots of opinion. I think that does happen. But we might just, when we hear the other's opinion, we might find ourselves inquiring into it to find how they got to that position. I think. I think we're going to talk about a lot of things, and I suspect, knowing us as we do, the news is going to
mm,
dominate a lot of our conversations, which is absurd because there's almost nothing we can do about it. All we can do is sit and moralize about it, or sit and shake our heads in despair, as people have done for thousands of years. But we're not going to be able to do anything about it. We will just be two old men, me older than you, but we're going to be two old men just grumbling about the state of the world. And is that, do we need more of that? Or should we be going, this is the solution? Musa, they need to do this, and they need to do it fast. Do we need to
what
do that
is?
stuff?
Let me ask you a question, Jonathan.
Hmm.
Uh, what is on your mind these days? Over the last 5 or 10 years, what kind of issues have been perplexing you?
What's on my mind?
Because I can tell you what I'm worried about.
Okay, let's start there because an awful lot is on my mind. This is every day. It whirs around. So tell me what's on your mind.
Okay. I'm very worried about the fragmentation of society that we see. Yeah. I'm worried about the atomization and the polarization of just take a simple question. What does it mean to be British? What does it mean to kind of grow up in this country? What does all of that experience, so the composite experience of being an Englishman, what exactly is that? And so one of the things that I've found, I think probably since 2014 and 15, and perhaps there's an element of maturity about this, but I also think that there are strong forces at play which are trying to culturally appropriate these things and atomize us and split us as a society into different factions in lots of different ways, whether it's ethnicity or class or faith, um, or certain political positions on certain things. Are you one of those people that wants to pull the statues of colonizers down, or are you one of them that wants to put them right back up? Do you know? And underneath all of this, my gut feeling, Jonathan, is that this could just be resolved with a good conversation. Maybe that's a very, very naive view, right? But what exactly is going on here? When a statue in, say, Bristol gets pulled down, and one group of people say that we must get rid of this, it represents an absolute travesty in our history. And then, some other group, often a more right wing group. Often it's a left right wing split, but not exclusively. You know, um, just finds this absolutely scandalous and wants to talk about the great history of empire and all of these. And underneath all of it, Jonathan, if we think about it, there's competing narratives on what that means, what that statue or what that symbol means. Now, why don't we just have a conversation about it instead of being scandalized about a statue being brought down
Because
or
it's
put back
because
up?
it's not so easy. Because
Yeah.
we, I mean, you refer to contested histories, but really we have different stories about the world. And we grew
Sure.
up in different stories about the world, and the way we each are, perhaps individually within a family, we might be different sort of characters, and some views of the world will resonate with me better than others because of just the very nature of who I
Sure.
am or who I've grown to be. And then we have all these stories of the world which now need to fit into the soundbox of the world and what it is. And we have a world with these statues that were put up by people long gone, the statues of the dead put up by the dead, of which some of those dead didn't like other people. I mean, this idea that we are in some harmonious thing until something disrupts it is illusory. We are constantly jostling and in conflict and working out ways to be together or working out ways not to be together. And I think what you're talking about, or what I hear you talking about, is where we move the scope of things in how we're going to live together. Well, we'll live together by not living together. We'll live together by dividing and being apart, which of course is actually quite easy to do. Any sort of conflict, I can say, well, I'll push you out, but I'll never get the skill. I'll never get the skill to resolve things. The harder skill is how we're going to live together on an equal platform. How in the flood do we all share the same branch together? How's that possible? Well, that's a skill that takes years and years and years and generations to develop. But as long as we go in the other direction, as long as we keep splitting, we will head towards conflict. If we go towards cooperation, well, we're going to have to make some compromises because all those divisions are there. There's divisions of resources. There's divisions of economy. They're there. There's other divisions people talk about of ethnicity and these other stories. Well, I think they have very little, they're not what we do. What we do is in a sense what matters. Who we are, because of how we are, is what matters. Who we are is how I categorize you. Well, that's just worthless paper lining in the bin. Whatever I decide to categorize you at is nothing to do with who you are.
But I get the feeling, Jonathan, that this kind of categorization of people, I think it is useful. I think it's a bit like we think in psychiatrists in terms of diagnosis. If I diagnose you with depression, it's useful, right? If you diagnose yourself with depression and come to me, it's not useful. The first thing I need to do, right, is I need to throw that right out the window. Depression, PTSD, bipolar, ADHD, whatever it is, I need to start from the fundamentals in understanding things. Does that make sense, right? And what I think a lot of what's been happening more recently is this kind of labeling, and this very crude labeling of different factions of society, which it's really interesting to me because I sit on the fault lines of many of these factions, right? So I'm English, I'm British, I'm also very Pakistani, right? I'm also Muslim, and that seems to have become a fault line in society. I'm not actually an immigrant, but my parents were immigrants, but I have a sympathy, I suppose, with people from immigrant backgrounds because I am from one as well, right? And so what I had always understood as a very cohesive story, a kind of Britain which was comfortable with itself and comfortable with its history, I'm now seeing pulled right apart. And I'm extremely worried about this. And we need to, even if it's just like throwing some pebbles into the ocean, I think the only way that we can begin to try and build that cohesive story again is by at least beginning to have some of these discussions about what experiences are like for different individuals, what the contested histories are, how we can begin to understand them and piece them back together again.
But that's because we can, because we don't actually disagree that much. We just see things very differently.
Mm-hmm.
But you're not. Well, I don't like the car you drive, but and that's about the bottom line.
Well, tell me about that. Why don't you like the car I drive?
No, I'm not going to get in there.
All right.
Get me annoyed. There you go. So certain things do annoy me. But the thing is, what are you suggesting we should have? Typical sort of TV debate. Let's get two people with strongly opposing views and get them together and see if we can find some common ground, or see if we can get them to argue really well. Is it sort of like Jerry Springer? Let's create the argument. But because that's what we do when we bring people together in an unmediated sense who really oppose each other's views. We just see things differently, but kind of like the exploration.
You know what I've become more skeptical over the last few years is kind of the columnists or the talking heads that we'll find, some of them very famous, all around us. And some of them come out with such bizarre views that one just begins to feel as if they're almost almost a caricature of themselves, right? So the conversations that happen in the media in the United Kingdom are not, I would posit, the conversations that I've had in offices or work environments or, with friends, right? Even with friends who have diametrically different opinions to me, they're extremely skewed conversations. And I think that they're skewed conversations because there are some individuals who want to have, some individuals profit from those skewed conversations. They may profit financially, they may profit politically. There's a certain advantage in taking certain extreme positions, isn't it? That is not how. Yeah.
Do you think they profit? Do you think they profit, if you like, existentially? Because if we have a strong opinion we can hold on to, one, that helps us through the total meaninglessness of life. And there's many forms of that. People often go, "Oh, that's what religion does," but that's what an awful lot of things do. Gardeners do it; they live for their garden. But if I have strong opinions on how plants should be planted or how taxes should be raised or how prayers should be given, if I have strong opinions, it's actually quite stabilizing the world. But also the resistance to those things that aren't me, the bugs in the garden, the other religions, the non-religions, the other politics, the other. When I resist those, the resistance is also existence. In other words, in the uncertainty of life, perhaps all these holding positions and the dogma we have to follow because we've always followed it and my father followed it, my father's father followed it, and this is what's right. All this stuff, which the internet is absolutely full of strongly held, pointless opinion. And I'd really like to have strongly held, pointless non-opinion. I think that would be I think that's my contribution to the world.
Well, I don't think, Jonathan, I mean, strongly held opinions, fair enough, right? As long as, firstly, I think so. As long as, firstly, it's amenable to real argument. Why is it that we can't change our points of view? Why must, when these kind of economists come out, or these talk show hosts, they have these debates, they don't change their view. No, I've never heard anybody saying, I've never heard even in the House of Lords or the House of Commons, the Prime Minister, you know what? That's a really good point. Let me think about that because, I'm gonna read up on that, and I'm gonna come back to you on that because that might make a really good policy. That doesn't happen, is it?
I mean, it's funny. I do this with my daughter. We're having a discussion. Yeah. And I'll go. I purposely, when she makes a good point, I say, "Actually, that's a good point. I need to rethink it." But of course, you don't get that in politics. You have debate, but debate without purpose, because ultimately, no one's going to change their position. And there's something about anthropology which I find fascinating because anthropology is the study of other points of view. It's the study of other perspectives. It's the fact that people in different places see things differently, and we all come from different places, and we all see things a bit differently. And sometimes those other places at different times. It's fine. We just have a different perspective of the world. You would think anthropologists don't get into nasty debates with each other where they've got to be right. You really would hope they wouldn't. But some of them get into the most atrocious arguments with each other because they've just got to be right about their opinion on people who have a different perspective. And you're like, unless, you see, they follow your view that it's okay to have a strongly held opinion that can be debatable. But the debate, where's it getting us? It doesn't mean you give in to nonsense, but you explore it. But you have to explore it with the openness to shift a bit. I mean, I haven't shifted in this discussion at all, so maybe it's a load of nonsense.
No, but Jonathan, I think that's the purpose, isn't it? And that's what I really want to do with this particular podcast. Is I want to have the discussion. I want to have the exploration. I'm not going to completely change my views on certain things. I'm sure I have certain very deeply held beliefs, right? But I'm open to questioning some of those beliefs and the foundations upon which they rest, right? And I want to do it in a decent manner. I want to do it with you, and I want to try and construct some kind of understanding or meaning of why it is that. So often in the last 10 years, I've just been really aggrieved. I remember when I first got aggrieved, David Cameron came out and said a couple of weird things, right? So firstly, he started saying multiculturalism had failed. I thought this is very strange. What does multiculturalism mean? Multiculturalism cannot actually fail because clearly we're all multicultural. But multiculturalism as a certain political narrative has failed, according to Mr. Cameron. Okay, yeah. And then he said something, I think a few months later, were really, really weird. He said, some days I wake up and I'm an Anglican, and some days I'm a less devout believer, and some days I think it's all hokum. Something like this. I'm paraphrasing, right? And I think that's just the British experience. And I was really interested in this. I think some lads from the mosque were also really interested in this, and we started thinking, okay, we want to find out what the indigenous kind of faith of people in this country is, right? So we went like, sort of in the Surrey London area, right? So local lads, local moths said, "All right, what we'll do a survey." They call me in because I'm a psychiatrist, and they say, "How'd you do a survey?" Do you know? And so I told them some principles of doing the survey, and I think ultimately we took some questions from the Pew Religious Center. I don't know if you've heard of it. You know, it's a methodologically sound way of doing a survey. You know, the questions have been thought through and these kind of things, right? And so then we went around doing a household survey. And what okay, this was 2014. In 2014, ISIS had blown up big time, and the BBC was insisting on calling them Islamic State. In France, France has a very bad history with this immigrant Muslim population. Even in France, they were calling them Daesh. They understood that calling them Islamic State would be a bad thing. I don't know why. All the time on the radio, the television, you could just hear Islamic State has done this, Islamic State has done that. So I went around doing this survey, and I'm a doctor in a clinic. You know, my day-to-day experience with people is very nice. They're very thankful of me. The amount of hatred that I got just doing this survey. I had dogs, unleashed on me. I had all kinds of, awful experiences. Right? And these weren't offensive questions. They were standardized normal questions. And since that time, I've just began to kind of feel that hang about that the Britain that I grew up in either is changing, or there was some kind of veil over my eyes that I couldn't see this. Now things that I see all the time, and this atomization. And when I try and explain to people, I hadn't even had that experience after September 11th and the what is it, the 7/7 bombings and all of that.
Just the thing is, well, I mean, we can do
Yeah.
this over several things. I mean, I would really love to understand what it means to you to be a Muslim, because I don't really have a faith. I might have an ethnicity, but I don't have a faith. I mean, I'm a spiritual person, I suppose, in many ways, but I don't have a faith. And I'd like to know what that is, and I'd like to know what the social side of that is, and I'd like to know what your experiences are of living in this country and encountering all these things, and what all that means, and what all that means when organizations who use violence adopt it in your name or within your bracket. What does it mean when you have a violent ethno-nationalists set on a point of aggression, saying basically you're part of our plan, and I don't feel like part of their plan. What you're caught in a similar trap as well, and I'd like to explore that. This is going to take time, but I understand when you talk about being Muslim, I don't know what that means. I just don't know what it means in the slightest. Apart from I've been to a mosque,
Sure, but yeah.
but I don't know what.
Okay, but this is a really appealing thing about you, Jonathan, because it's part of me. It's part of my identity. It's very important part of me, right? Yeah. When I talk to you about it, if we're having a coffee or we're just walking down the street, we go for a walk in the park, and I don't find this that often, and I don't know why. You actually, you actually listen, and then you reflect things back to me. You discuss them. We can think about them. You don't agree with, my experience of the faith clearly, or all aspects of it, but you don't dismiss it or reject it, or you don't. The other thing that you don't do, which is really interesting, is you don't suddenly become self-defensive, right? So, for example, my wife gets this quite a lot. She wears a headscarf, right? Um, and she tells me, that whenever somebody discusses with her about their headscarf, they start getting defensive about why they don't think it's appropriate. And, she's like, of course, we live in England. Most people don't wear their headscarf, and they don't have the same views as, modesty of dress as, Muslim women. We do get that, right? Why do you have to be so prickly about it? right? And I mean, this is really appealing trait in you, that you're not prickly, right?
I'm fascinated. I'd love to
Yeah,
know I'd love to know what it is to wear a headscarf. I mean, I wear a hoodie, I wear hats
yeah.
throughout the year. I'm rarely seen without a hat.
Mm.
So covering the sensation, the physical sensation of covering the head is very important to me. And I cannot, I suspect somewhere in there, anyone who covers their head every day and does so as a matter of respect to the greater things, it must be a sensorial experience as well. I mean, I'm fascinated. I'm fascinated.
Sure.
I mean, you realise how much of a narrative it is that people have a problem with this, because everyone's wearing head coverings all the time. I mean,
Well,
usually
the thing
the
is, it took
English in
me
winter. I mean,
it took me
it's cloth. It's cloth and
it
covering, and we do it.
it took
And
me
so we
ages to
go, no, go on,
work
sorry.
out what this was, and essentially what it is that for lots of people, this kind of simple act of covering their head with a headscarf, which my wife does every day without thinking about it, and many people around me do as well, um, is a politicized statement. And it's not. It's not. Basically, it's not. It's not a political statement. My my wife and other people who wear the headscarf are not wearing the headscarf because they are rejecting British values and they want nothing to do with it, and we're going to keep our foreigners. Thank you very much. Right. But this is exactly how it's perceived. Now, if
No,
I just wish, Jonathan, we could have that conversation. And I just think if that small conversation happened, how many barriers would break down?
is it
Yeah.
perceived like that? Is it perceived like that? Or is that a story that those who wish it to be perceived like that push out and push out and push out? Because if we'd heard that story differently, if we'd heard that story as just a way of dressing, if we'd
Oh,
heard that story as of a self-description from the people who do it, but no, we're told a different story by people, by the way, who don't do it. They're not
well,
engaged in that practice themselves, so they can have no understanding of what it is. I mean, I do not disagree with any of your experiences of Muslim, because I don't have them. I know very little about the faith at all. I know very little about most
okay.
faiths. So the point is this: you experience this world through these things, and for someone to come along and say, oh, that's not British, or that's not Brighton, or that's not my party, or this is not my football club. I mean, I mean, it's a position, but they'd enjoy it so much more if they would only listen. Because there's a beautiful story there to be told, an absolutely beautiful story, one where I can understand, and I can guarantee that all how many people wear the head covering. I mean, must be millions, if not
Yeah,
billions.
yeah, of course, of course. I'll
They
tell you
don't. They
another.
don't. It's not all the same. It's different for different people,
I'll,
and
I'll
they're
tell you
choosing different cloths.
another kind of experience along the same line, which I just find fascinating. Right. So, as a doctor, um, my female surgical colleagues, especially my younger female surgical colleagues, complain from time to time about the misogyny and the sexism that is present in surgical training cultures. Right now, I happen to do my surgical training actually in Brighton. Right, not that I was going to be a surgeon, but you have to do it as part of your pre-registration house officer year. Yeah, it was busy. It was stressful at times.
When was
Um,
this?
it was in Brighton. This was when
When
was it? 2009, 10, I think,
you
probably.
didn't do you
Eight,
didn't
no,
do sometimes someone's septum deviated septum in the nose at any point, did you? Which went a
no,
little
no,
bit
no.
wrong. No,
No,
okay.
I did 2008, 9. Brighton, as you might know, I don't know if you picked this up, the surgical department is now under investigation, but that's happening
That's
all over the
right.
country. Yeah, it's happening all over the country. Okay, I didn't see any sexism there, Jonathan. I didn't see any. Do you know? Um, I worked with some, uh, young people, some very attractive women as well, I must say, right? Of course, I kept things professional. I was completely oblivious to sexism in surgery. But the thing is, of course I would be, I wasn't going to get hit up on, was I? I mean, I was not that demographic, right? How would I know exactly what the experience is for other people? And so when I speak to some of my colleagues about this, who have been through these things, I come from a position of, that's your experience, tell me about it. Not from a position of, oh, I'm skeptical, I've never seen it. It must not exist. And I just wonder if we just understand from the position that we are seeing the world from, how that colors our experiences.
Yeah.
Yeah, and I mean, perhaps it's because it's my job to understand other people's experiences. Perhaps I'm a bit better at doing it. I don't know, but I just find it bizarre that, and there's a whole swathe of people do this, especially many of my male, often older, often surgical colleagues. This is all rubbish. We've never seen it our whole career. Well, you wouldn't, would you? Do you know what I mean? Because you're not that demographic that's going to get, yeah.
And it's very hard. I mean, it's very hard for everyone, wherever they are. It's very hard for them to see their own power.
Yeah.
It's hard. It's a human attribute. We just can't quite see it. It needs to be pointed out. And then, as we're seeing in this sort of current turmoil of identity politics on the backlash, it's very confronting to see it. And then when people feel a bit of slack that they might actually get listened to, they go hell for leather to be heard, which causes further backlash. So these things are tricky. These things are hard. I mean, what does it mean in a society where people can't see the power they yield? None of us. I mean, a parent over a child forgets how much power they have over the child. They do. But owner with the dog, they don't quite notice, or they rationalize it and say, I feed my dog at 7 o'clock every day. Well, maybe the dog's hungry in between. I don't know. It's all exercises of power. The car driver, he's got power over the bicycle. He's got power over the pedestrian. All this is constantly going on, but it's hard for us to see. So what does that mean? Back to meaning again. Back to, we don't have an answer, but what does it mean when we can't see what we do to others?
Well, I think, Jonathan, the thing is that the sum of human experience must be how we relate to each other, isn't it? I don't think we can live as a hermit, off on our own, and just feel that that's okay, that we don't care about anybody else. We just need to, we are individual pockets of people. But if we have these problems in understanding other people's experiences, but we also want to constructively live within society and take, be positive members of our communities, then we need to have these discussions. We need to have sometimes the not so obvious discussions, sometimes the difficult and painful sometimes discussions about why it is that we think the way that we do, and unpack all of the symbolism behind that. And that's why I really want to do this podcast, Jonathan, right? Because I don't hear enough of that. And me and you debating about, I don't know, what will we debate about? Yeah, whether you're left wing or not.
Yeah,
is yeah.
But I'm not right with either.
Clearly. But
I'm
okay.
definitely not in the middle.
Yeah. Okay.
So,
Okay.
yeah,
Okay.
I mean, that's it. But I mean, I think that's it. I mean, I think if anyone was to listen to this,
yeah,
they're not going to come away going, oh yes, I've got an opinion on this. Well, they might do, but it allows. I think it's very important to gives plasticity to the thinking process. It allows the brain to think. It allows it to open up new ways of thinking, or same ways of thinking, but take them in a different place. It encourages the conversation. It doesn't close it down by righteousness and flag planting. Let's explore. Let's explore the views of others. I think that's very, very important. some point I'd like us to start interviewing, but we'll get there.
We'll get there. Yeah.
So what do you think? What do you think we said today? Just as the psychiatrist and you summing up the session with the patient. What do you think?
I think we thought about the podcast. You know what our motivations are for doing it. I think we talked a little bit about the kind of friendship we have, the chemistry that we have between us, but also what we hope to do with this podcast, which is not give simple solutions and simple answers, but explore what is going on underneath all of these meanings and positions that we often ascribe and we take fixed as fixed dogmas. And we know, I think we've had this discussion between ourselves, that might not be everybody's cup of tea, but it might, for some people, stimulate certain thoughts or discussions that might be just a little bit outside their comfort zone, or they might not have thought about things in that way. And that's, I think, what we really want to do.
Even when they turn around and say you're wrong.
Well, they're going to do that, Johnson.
Why are they going to do that? Why? Can they just join the conversation?
Well, that's the invitation, isn't it? Join the conversation. I suppose if we're going to do the typical podcast thing, tell us what you are thinking about this. Write it in the reviews and the comments underneath. We will read them. We'll look at them. We will change our discussion points and our topics based upon them, because we really want to hear from the audience and get a taste of, how this is coming across.
But I want them to join in the start of the conversation too. I mean, look, you can go anywhere and leave your angry from Brighton comment. I want them to join in I want them to think around the question too. I want them, if they liked it, to just join in the style. That'll be beautiful.
Sure. All right. Okay. And so I suppose the last thing, Jonathan, is we were just discussing. So we've called this thinking around the question. Equally, we could have called it "We Have No Answers," right?
I think so. We're going to put a colon in there. All right. Thank you very much. It was nice. Cheers. Once again. Thank you.
Bye.
Bye.